Good afternoon, everyone. It's wonderful to join everyone this afternoon, and thank you to the Montrose Center. Thank you for having us. What a wonderful organization you guys are, and the work that you've been doing is just fantastic for a very long time. So I want to acknowledge that, and we have Austin Ruiz here with the Montrose Center and the director, Dr. Robinson. So they'll speak toward the end. So let me just begin by thanking Congresswoman Garcia and our congressional delegation. Congressman Green may join us later, but I want to make sure everybody knows we are doing all of this thanks to the commitment of our congressional leaders and the Biden administration that committed these funds that are allowing us as Harris County to disperse them in these kinds of programs. And of course, we're making the decision to focus on issues that have long been forgotten, but we couldn't do this without the funds that they have sent our way. I want to acknowledge the other initiatives we've been able to achieve through their support. Our Brighter Futures for Harris County Kids program, where we've invested over $80 million in early childhood education, child care, and maternal health. $7 million to tackle maternal and infant mortality, tens of millions of dollars in support for broadband, for nutritional programs, all kinds of initiatives, and we'll be excited to celebrate those in the future. And of course, we need to note the $1.4 billion, and that's from our local county dollars, not the ARPA funding, that we've allocated or we're allocating toward crime prevention and justice. That is an unprecedented investment, just as it's been every single one of the years I've been in office, to promote the well-being and the safety of Harris County residents. Today's announcement is another big step in promoting that well-being. On Tuesday, Commissioners Court unanimously approved over $14.3 million of these funds for behavioral and mental health programming. This investment will tackle one of the biggest issues facing our community today, and that is mental health challenges. And the program will address the roots of mental health and behavioral health crises, especially among youth. A 2020 Mental Health America analysis of 9 measures indicated Texas residents have the least access to mental health care compared to the rest of the country. Texas ranks last out of 51 states, including the District of Columbia, for mental health access. The national average of providers to individuals in the community is 1 provider for every 731 residents. That was the number in 2021. In the United States, the national average of provider to residents is 350 to 1. In here, we are at 1 provider for every 731 residents. Texas has the last place when it comes to providers to residents as well. By comparison, Florida has a ratio of 590 to 1. Even those who don't suffer from mental health issues are impacted. Too often, individuals struggling with mental illness can't get help. They end up losing their homes, they end up losing their jobs, or becoming involved in our criminal justice system. 80% of our jail population has a mental health indicator. We know that the Harris County Jail is the largest mental health provider in the state of Texas. For low-income individuals, interaction with the police, arrest, or jail is often the only way to access mental health services. The public beds that we do have a wait list that has increased 600% between 2012 and 2020. It's a big issue for youth. The mental health needs of school-aged children have increased for over a decade. And this has increased even more during the pandemic, during which 140,000 children in the United States lost a parent to COVID. According to the CDC, in 2021, more than a third of high school students reported they experienced poor mental health. 44% reported they felt sad or hopeless in the past year. The recommendation by the National Association of School Psychologists is 250 students per counselor. Every single ISD in Harris County falls short of that recommendation. The statewide average is 392 students per counselor. In Harris County, we have 1,111 students per counselor in Houston ISD, 568 in Katy ISD, 526 in Cy-Fair, and so on. Spring ISD, 441 students per counselor. There are major issues when it comes to substance use as well. The Harris Center saw a 67% increase between May of 2020 and April of 2021 in callers to the crisis line, where the primary concern was substance use. In 2020, over 41 million Americans had a substance use disorder, yet only 2.7 million, approximately 6.6%, received treatment. And while we have great programs like our alternative responder program that sends experts to deal with mental health crises, even Texas who need intensive mental health treatment, not just the preventative treatment, don't have sufficient access to psychiatric care. That's why today's announcement is so important. This set of programs funded by that multi-million-dollar investment will provide services to our community to address mental health issues before they become debilitating and before they become a crisis for individuals and for our community. We do this in the following ways. First is by building the mental health workforce of tomorrow. Second, by better serving our families with mental health and substance use treatment. And finally, increasing mental health resources for youth and for schools. First, the first point, the workforce of the future when it comes to mental health. We're working to increase the quantity of trained mental health professionals. We're adding funds for organizations like the Montrose Center, like the University of Houston Medical Schools, and the network of behavioral health providers, so they're able to retain and hire more mental health providers. But we're also funding initiatives to recruit more high school and college students into these career paths. The second piece, connecting residents throughout our community with mental health and substance use issues. Some of the programs we're funding include the Council on Recovery, which will provide substance use disorder treatment at clinics and the Psychiatric Center. The Santa Maria Hospital will provide overdose prevention for county residents. And the final piece is increasing mental health resources for youth and for schools. Teenagers and youth who face mental health challenges and trauma will be better served because of this initiative. We're funding programs like Communities in School Houston to provide school-based mental health services. Covenant House of Texas provide therapy services for homeless youth, and the Houston Area Women's Center, which provides counseling for women and children who survived abuse. Every single one of our children, no matter their circumstances and no matter their income, deserves our best efforts to meet them where they are and provide them the mental health care they need. Combined, these programs will impact over 20,000 Harris County residents. We will develop over 3,500 workforce members, counsel over 3,000 children and adults, treat over 15,000 individuals suffering from substance use issues. And these estimates don't cover the ripple effects of these programs, like reduced criminal justice involvement or reduction in psychiatric hospitalization, less stress, less anxiety for family members. Now, I'd be remiss not to mention the topic of school safety while we're talking about these mental health investments, and in light of the recommendations made by the Harris County Safe Schools Commission at Commissioner's Court earlier this week. Since the tragedy at Uvalde 3 months ago, we've not only been mourning the lives lost, but working to figure out what we can do to make sure this doesn't happen again. We're going to keep pushing for legislative improvements that foster responsible gun ownership. But we know that the state regulates and prevents Harris County from regulating the purchase, the sale, or the storage of guns. So we have to figure out what we can do. That's why we've invested in violence interruption programs, in gun buyback programs, gun lock initiatives, and so many other initiatives. This investment in mental health care in our schools is part of us doing some of what we can do, but that doesn't mean that we don't still need changes in legislation so that there's responsible gun ownership and common sense gun safety policies. Now, while we're doing all of this, we've heard recently an attempt by the state to defund us at the county. So these are initiatives we're doing with American Rescue Plan dollars, one-time funds. But the idea would be to try to continue some of them with county funds. There is no way we could do that if the attempt by the state to defund Harris County succeeds. Without significant investments in preventative mental health care, we will continue to see overcrowded jails, increases in violent crime, substance use related deaths, suicides, children struggling with school success. So if you care about public safety if you care about the future of our children, if you care about a stronger community, you should care about mental health issues and the investments we're making today. Mental health is fundamental to the overall health and well-being of our county's youth, families, and all individuals throughout different stages of their lives. And I'm so proud to take this step. It won't solve all the problems. It's a bigger issue than this program can address. But it is a big step in the right direction, and it's a big step in the right direction because of the collaborative approach we have here with so many great organizations. So I'm going to repeat my remarks in Spanish and then welcome Congressman Green. We'll hear from Congressman Green, from Congresswoman Garcia, from Shabra Endley with Communities in Schools, Andrea Usanga with the Network of Behavioral Health Providers, Dr. Robinson, and Mr. Ruiz. Buenas tardes y gracias por acompañarnos. Primero quiero agradecerle a nuestra delegación al Congreso por su enorme apoyo con estos fondos federales que nos permiten lanzar el programa de hoy. Este programa es parte de tantas iniciativas nuevas como el compromiso de $80 millones hacia los niños y la educación temprana. También quiero recordarles a todos nuestra inversión de $1.4 mil millones en atacar el crimen en el condado Harris. Es una inversión récord. El martes la Corte de Comisionados aprobó de manera unánime $14.3 millones para abordar los temas de crisis de salud mental, de comportamiento y abuso de sustancias. Esta inversión va a atacar una de las mayores crisis que enfrentamos el día de hoy. Esa es la crisis de salud mental. Texas es el último estado en cuanto al acceso a tratamiento de salud mental. En promedio, debemos tener 350 proveedores para cada residente en los Estados Unidos. En Texas tenemos 731 proveedores, debemos tener 350 residentes por cada proveedor. En Texas tenemos 731 residentes por cada proveedor. Aún las personas que no tienen retos de salud mental se ven impactadas. Demasiadas veces aquellos con retos de salud mental, abuso de sustancias, pierden sus hogares, pierden sus familias o terminan involucrados en el sistema de justicia penal, lo cual nos cuesta mucho a todos nosotros. Sabemos que nuestra cárcel del condado Harris es la entidad de salud mental más grande del estado de Texas. Un 80% de la población en la cárcel tiene algún reto de salud mental. Para muchos individuos de bajos ingresos, la interacción con la policía, el arresto, la cárcel, suele ser la única forma de acceder a los servicios de salud mental. Y aún ahí hay una lista de espera que ha crecido un 600% entre el 2012 y el 2020. Es un tema importante para los jóvenes. Además, durante la pandemia se incrementó esta necesidad. 140,000 niños de edad escolar perdieron un padre durante la pandemia. De acuerdo a información federal de la CDC, en el 2021, un 37% de los estudiantes de secundaria reportaron que tienen baja salud mental y 44% reportaron sentirse sin ninguna esperanza. La Organización Nacional de Psicólogos Escolares recomiendan 250 estudiantes por consejero escolar. Ningún distrito escolar en nuestro condado Harris llega a esa meta. En promedio, en el estado, 392 estudiantes por consejero. Aquí, el Houston ISD, 1111, Katy, 568. Hay temas también en el consumo de sustancias, problemas con eso también. De acuerdo al Harris Center, cual ofrece salud mental, hubo un incremento de 67% en llamadas a nuestra línea de crisis entre el 2020 y el 2021. Tenemos que atacar la prevención de la salud mental, el tratamiento de uso de sustancias, para que esto no se vuelva una crisis aún mayor. Esta inversión logra eso de tres maneras. Primero, construyendo la fuerza laboral de salud mental. Segundo, atención preventiva a la salud mental de padres y muchachos. Y finalmente, incrementando los proveedores de salud mental capacitados en las escuelas para nuestros niños. La primera porción es incrementar los proveedores de salud mental con fondos para que más jóvenes, estudiantes en la universidad y organizaciones puedan reclutar y dirigirse hacia carreras de salud mental. La segunda porción le otorga fondos a organizaciones que financian tratamiento para el trastorno por uso de sustancias, para temas de salud mental, a familias a lo largo del condado. Y finalmente estamos financiando programas como Communities in School para brindar servicios de salud mental en las escuelas, esos consejeros que necesitamos. Todos nuestros niños, sin importar sus circunstancias, sin importar el ingreso de sus padres, deben tener acceso a la salud mental que necesitan, al tratamiento que necesitan, para que puedan crecer y desarrollarse de la mejor manera. Estos programas impactarán más de 20,000 residentes del condado Harris. Entrenaremos 3,500 proveedores capacitados. Le ofreceremos tratamiento a 3,000 muchachos y adultos. También le ofreceremos tratamiento de sustancias a 15,000 personas. Y estos programas no incluyen el efecto dominó, la reducción de participación en el sistema de justicia criminal, la posible reducción a las hospitalizaciones psiquiátricas y más. Desde la tragedia en Uvalde hace unos meses, estamos hablando mucho de qué se puede hacer en las escuelas. El Estado nos prohíbe regular la compra o la venta o cómo se guardan las armas de fuego aquí en el condado Harris. Entonces, esto es lo que sí podemos hacer. Y no es suficiente, igual tiene que cambiar la ley, igual necesitamos políticas muy obvias, muy básicas, para que haya más seguridad en nuestras escuelas, más seguridad en nuestra comunidad. Pero esa responsabilidad está con el Estado. También les recuerdo que estos fondos son fondos nacionales. Cuando se acabe el plan es continuar con esta iniciativa por parte de nuestro presupuesto local. No vamos a poder hacer eso si el gobierno estatal se sale con la suya en lo que están intentando hoy día. Y eso es intentar remover muchos de los fondos que utilizamos nosotros para la salud pública, para la seguridad pública y más. Entonces seguiremos trabajando y le agradezco a todas las organizaciones que van a recibir estos fondos. Son 11 organizaciones, estamos muy orgullosos de ellas. And I do want to mention it's 11 organizations that will be receiving funds to carry out these 3 priority areas. We'll hear from Congressman Green next.
Thank you very much, Judge. And I would like to associate myself with your comments. I think they were absolutely outstanding. And I also salute you for the outstanding job that you've done. You have weathered a pandemic, and you have done things that have made a difference in the lives of people. So I'm very proud to stand here with you today and salute you for your stewardship in terms of how you've been able to manage the federal dollars that we have been according our county. And if my friends would be so bold as to join me, I'm going to ask that we give the judge a hand for what she's done. I am honored to be here today with the Honorable Sylvia Garcia, whom I will have the preeminent privilege of presenting after I have made my comments. But before I make my comments, I just want you to know that she has been a great partner for me in Congress. She brought a bank of intellect that has been of great benefit to our city, state, and of course to Harris County. Friends, it is easier to build a child than to repair an adult. This money is going to be used to make sure children get the help that they need so that they will become healthy adults and contribute to society. To a certain extent, this program will help with homelessness. I know. I have visited the persons who live under the bridges. A good many of them need mental health help. They need what this program can provide, but we didn't do it. And now we see the results of our failure to help the young before they become adults who need the repair that sometimes is impossible to accord them. Homelessness can be impacted by this program. No way to really measure it, but I understand how the system works and how people function in our society. Food is a nutritional program. The Houston Food Bank does an outstanding job, but they can only do an outstanding job if they have the resources. These are resources for the food bank. Some $6.5 million can help with nutritional needs, some portion of that to the Houston Food Bank. $14.3 million for the mental health aspect of this, divided among some 11 organizations. So I'm proud to say to you that the judge has been a visionary. She's been able to take on the great challenges of her time while she's been in office. And she has managed as well, I think, as a person could manage these circumstances given the conditions that she had to deal with. This is a great opportunity for us to do our part here, but also for the state, as the judge has mentioned, to continue this. It's not enough to start a program. It's the continuation of it that makes the long-term difference. And I believe that if we do this properly, we will have few people making their homes under bridges and with tents along the side of the road. America's a great country, richest in the world. There are too many people who need help, especially in the area of mental health and with food in this, the richest country in the world. In closing, I welcome the opportunity to say to you that I will continue to work with my colleague, whom I'm about to yield to, and we will be working with the judge, but my colleague is a person who came to Congress equipped for the job. It wasn't on-the-job training for her. She knew what had to be done, and she's had a hands-on experience with getting it done. I am so proud to yield to the Honorable Sylvia Garcia, my colleague in the House of Representatives.
Thank you, Congressman, and thank you for bringing us together, Judge, on such an important occasion. And for me, listening to my colleague talk about hands-on experience, it brought me back to being a social worker. And the person I'll get to introduce is a clinical social worker, and I told her that that was my first degree. And certainly, Judge, a lot of the issues that we're addressing with these program dollars were sadly issues back then when I was a social worker. But we've made some progress. I mean, this building is progress in itself from the days back when I was a social worker. But it takes a lot because we continue to grow. So as our population grows, some of the challenges grow with it. So any opportunity that I have to find dollars to address some of the issues that I used to try to tackle on a first-hand basis, to now be in a position to bringing home the money instead of just talking to the folks about trying to solve the issues is I find it very, very gratifying. So before I start, I do want to thank the judge and Commissioner Scored for the good wisdom of, as Judge Green said, of pulling the money together and finding the right way to spend it. Because it really is always alarming to me when we read reports and we find out that some local governments or some states are struggling with spending the money that we sent them. I've never heard that from Harris County. In fact, I was really pleased at one hearing in financial services, and my colleague was in the same hearing, I'm sure he remembers. You know, our Secretary of Treasury, Yellen, mentioned by name the Houston Harris County Housing Program as a stellar program on how they were really ahead of spending money and were ready and did in fact step in to help the state spend money because they were behind. Remember that, Judge? I mean, that's always good to hear because the dollars that we send is to go directly to people. It's about always putting people over politics. So in total, it is $20 million for behavioral, mental, and nutritional health programs to fight both the rise in mental health and food insecurity in Harris County. Now, the judge detailed the programs. My colleague has mentioned a little about some of the dollars. Now, for the food insecurity, it's 7.5. But I'm so pleased that we've put a lot of money into behavioral health because we saw it during the pandemic. The need for mental health, particularly for children, increased by the most it ever has. So that's why it's so great that some of these dollars will be going to the groups that work directly with our youth. These funds will also focus on behavioral health workforce programs, counseling, youth and family programs, and fight against substance use disorder. All these things add up. And lucky for those 20,000 folks, and hopefully we can send more money or they can make it stretch, that they can reach more folks, because we know that the need is great. And I know that the entire Harris County delegation, not only myself and Congressman Green, but Lizzie Fletcher and Congresswoman Sheila Jackson Lee, will all work together on this issue to make sure that we have the dollars that we need. But that's why I was pleased to have supported this programs from the very start. You know, President Biden had this vision that he had during the campaign of putting together all these dollars. He called it the American Rescue Plan. And that's exactly what it is. It's to rescue our families that were in distress, to rescue and help the families that were going through struggles during the pandemic, to make sure that we addressed all of their needs. So that with this plan, we've been able to put these dollars together. And Judge, you know, I'll just repeat what my colleague said. You have been an excellent steward. You've got good helpers in Commissioners Garcia and Ellis. And we know that when we send dollars to Harris County, that you will use them effectively, efficiently, and where it is most needed. And that's what we want to see happen, because we fight real hard to bring the money home. We trust you to make sure it gets to the right place. With that, I yield to one of the recipients and a fellow social worker, Ms. Shebra Indley from Communities and Schools.
First, I would like to thank Harris County for this generous funding and giving Communities and Schools of Houston the opportunity to continue to support students and families across Houston. Addressing mental health issues among the students we serve is of critical importance, especially now as we are kind of coming out of that pandemic fog. I'm going to give you some background about who we are as an organization. For 43 years, CIS of Houston has demonstrated measurable success in student outcomes. Our organization is recognized as a leader in understanding and evaluating what is needed to increase student success in our schools. We ensure that every student, regardless of race, gender, ethnicity, ability, zip code, or socioeconomic background, has the tools they need to be successful in school and beyond. Our student support specialists are embedded across 173 Houston area schools. And they are there on those campuses full-time to provide both academic and non-academic support. The funding from Harris County will cover our expenses for contracting with all of the mental health partners with whom we coordinate each and every year. The support enables us to expand the mental health services, which include support groups for students who may be grieving. It helps us expand supportive counseling services and provide one-on-one support for students and families. We can expand our reach now thanks to the support from Harris County. Our network of partners include professionals from DePelchin Children's Center, Nick Finnegan Counseling Center, the Council on Recovery, the Montrose Center, and Family Houston. And now I'm going to introduce my colleague, Andrea Osanga, from the Network of Behavioral Health Providers.
Thank you, Shibra. I want to thank Representatives Garcia and Green for working so hard to pass the American Rescue Plan. And of course, also Judge Hidalgo and County Commissioner's Court for appropriating this funding for behavioral health services. You've heard a lot about the great need that we have in our community for behavioral health services, but I just want to focus or just make sure everyone understands that at the exact same time where we are seeing unprecedented number of people who are seeking help for mental health and substance use treatment, we are in a crisis situation with our behavioral workforce. We don't have enough people entering into the field, and we have far too many people who are leaving the field. And in addition to that, we unfortunately really do not have a workforce that currently reflects the rich diversity of our local region. And so we are so pleased that Harris County has allocated $2 million to our organization for our workforce development initiative. And there are several components. I won't get into all of that, but we are going to be working on pipeline issues to educate and encourage high school and college students about what it takes to enter into the field. We will provide them with paid externships so they'll know what it is to work in a behavioral health organization. We'll have scholarships for undergraduate and graduate behavioral health students so they don't have to have financial barriers standing in the way of them being able to complete their program of study and graduate. And then we're also going to be investing in the current workforce by ensuring that they have culturally appropriate trainings as well as incentive pay so we can retain qualified and diverse behavioral health professionals. So we think that all of these components together, as I said, I didn't get into all of them, will really help us to kind of stop the bleeding, right, of the behavioral health workforce. And so, again, we thank our congressional representatives and County Commissioner's Court, and we look forward to working with all of you so we can ensure that all Harris County residents have access to the mental health and substance use disorder services that they need. And now I will introduce my colleague, Executive Director of the Montrose Center, Dr. Ann Robinson.
And I would like to also thank Congressmember Garcia and Green for bringing this money into Texas, into Harris County. I believe it was almost 2 years ago that the Network for Behavioral Health Providers, with us as one of the founding members, came to talk to you, Judge Hidalgo, about the crisis of behavioral health in Harris County and asked you to please help us find a way to expand the workforce and to serve the need. And I'm very pleased that you listened, and this has come back as one of the culminations of that. The Montrose Center, which primarily serves the LGBTQ community, has had a severe wait list for probably a year, and it's only getting worse. We have had to triage to serve the youth, people in crisis, and the uninsured who also could not afford to pay for a private practitioner or one of these telehealth mills that have popped up in the last year to get private services. So we're serving the most in need and at a time when our workforce is dwindling. So our funding will go towards both training people how to serve our community better, but also to give incentives to hire and retain therapists to replace some of ours that are retiring. So it is very important that the work that we're doing, because we also have a hotline. We get calls every month from people who are in crisis, and we have walk-ins from people who are in crisis, and we have a homeless camp that's just 4 blocks from here. But the work that our agency and the other recipients are doing are safety net projects. We are serving people who get left out from most of the industry and end up really cycling in and out of the hospital when they can't get basic behavioral health care, and that's what we all do. So thank you very much. And next. And let me introduce Austin Ruiz, who is also one of our staff members at the Montrose Center.
Just want to reiterate everybody's thanks for being here. Thanks to Congresswoman Garcia, Congressman Green, and Judge Hidalgo, the other recipients. I just want to kind of dive a little bit deeper into Dr. Robinson's comments, specifically about how this is really going to impact youth. Right now, we're seeing a mental health crisis amongst youth throughout the country. Specifically within the LGBTQ community, LGBTQ youth are much more likely to experience any type of mental health illness. Suicide is the second leading cause of death amongst youth in America right now, and for youth that is they're 4 times more likely to consider suicide compared to their heterosexual peers because of the stigma that they face when they try to live their true identities, when they come out to their parents, when they're kicked out of their homes, bullying in school. And so this is really critical for our youth program to be able to help bridge some of those gaps. I mean, just in Harris County, the Houston Health Department has reported that nearly 200,000 youth in the Houston area need mental health resources. And the Trevor Project estimates that at least one LGBTQ youth between the ages of 13 and 24 attempts suicide every 45 seconds in the United States. And so this is something that we're seeing really impactful in our community, specifically for our youth, who are the future, who are, our rising leaders in the community. And so what this is really going to be able to do is really open up our capacity to help youth, as Dr. Robinson mentioned, to be able to retrain staff, to help them get more credentials, to become better licensed, to be able to help other newer behavioral health professionals that are coming up through the pipeline. And so this is really going to be impactful, not just for our community, not just for the Houston community, but really for the entire state as we start to see this money trickle down and be used by not just us, but by other facilities and recipients from this money. So again, thank you so much to the judge, to our congresspersons, to the president, to the vice president who passed the American Rescue Plan. This money is really needed for us and for our local communities, and we're excited to be able to do the work and to do our part in this fight. Thank you.
Thank you, Mr. Ruiz, and thank you again, Director Robinson. And I want to acknowledge Leah Barnew's here from our County Administrator's Office, and big role in these initiatives, and she was also instrumental in the housing initiative that helped us reduce homelessness by 20%, along with the City of Houston in the years of the pandemic. We'll take any questions.
Judge, a question from my colleague off topic about the news about the monkeypox in the Harris County Jail. Just want to get your reaction to that and the containment efforts there.
Yes, I am aware of the case in the county jail. The good news is that it happened during the isolation phase of this person's booking. So they were already in COVID isolation, and that's where monkeypox was identified. We've got the Harris County Public Health Department involved, the Houston Health Department involved, obviously Harris Health. The sheriff and I spoke weeks ago when we first began the conversation on monkeypox about the fact that there was going to be a case in the jail at some point, inevitably, and making sure that we had intake procedures that would catch such a case. So they worked today. We've identified this case, and we need to continue to be vigilant, and so that it doesn't spread further in the jail. But the jail deals with infectious diseases routinely, and it's another reminder for the community to do your part. Right now, if you qualify for the vaccine, we need you to get vaccinated, and just recently we expanded it to men who have sex with men, and that is on top of the HIV positive individuals, the folks who are on PrEP, and several other individuals as well.
And because we're the full camera, would you mind to repeat some of those remarks in Spanish?
Sí, me enteré del caso de viruela del mono en nuestra cárcel del condado Harris y ya hemos estado en contacto con el alguacil. Estamos todos muy pendientes. Nuestro departamento de salud pública del condado Harris está involucrado. También está involucrado el departamento de salud pública de la ciudad de Houston y obviamente nuestro sistema hospitalario público. Es algo que ya sabíamos que podía suceder en algún momento. Desde que lanzamos todas las iniciativas para atacar la viruela del mono, hace varias semanas hablé con el alguacil González y hablamos acerca de la necesidad de tener sistemas que identificarían un caso de viruela en la cárcel. Y los sistemas funcionaron. El día de hoy identificamos ese caso. Las buenas noticias es que el caso estaba ya en contenimiento para el COVID. Entonces no estaba este individuo en la población general. Eso nos permite limitar hasta qué nivel se expone la población general a esta viruela del mono en la cárcel. Podría llegar nuevamente la viruela del mono a la cárcel. Tienen muchas precauciones en la cárcel para situaciones transmisibles, enfermedades transmisibles como esta, pero es un recordatorio para todos la vacuna. Si califica para la vacuna, por favor, vacúnese de una vez. Puede llamar al 832-927-0707.
And one more from me for the healthcare professionals here. As you know, today the Texas trigger law on abortion took effect. I wonder if, some of the professionals here have seen or expect to see any kind of maybe indirect impact from that, maybe more people seeking counseling services, something along those lines?
Well, I'll just start by mentioning, in case folks have any additional thoughts, our Harris Health System provides abortions when it's medically necessary. And we've heard from doctors and healthcare professionals who say they're inevitably putting women's lives at risk because right now they have to be basically on the verge of death before they can provide a medically necessary abortion. Well, where do you draw that line? And how do you know it's not too late? And so as we talk about the pipeline and healthcare professionals' jobs being made more difficult, this is absolutely it. So it's a very extreme law, no exceptions for rape or incest, and the vast majority of the community is against such an extreme position. But as someone that has to defend the health and safety of the community, look, I'll deal with natural disasters day and night, and we work to become more resilient. We're in the middle of hurricane season. Man-made disasters, that just breaks my heart. And to think of the women who are going to have to suffer and be driven to perhaps when it's too late before they can receive a medical intervention that might be necessary to save their lives is very concerning, and I am concerned about what that'll do to the morale of our personnel because I have heard about that already from medical professionals, and I've heard that our personnel in our public hospitals are having those concerns. Does anyone have anything to add? Okay.
If you wouldn't mind just repeating in Spanish as well.
Sí, me entristece mucho esta ley y la verdad es que nuestro sistema hospitalario público sí ofrece abortos cuando es necesario por el punto de vista médico. Lo que la ley hace es que básicamente la mujer tiene que estar a punto de morir antes de que se permita ofrecer el aborto. Tendría que estar al borde de la muerte. Entonces lo que hemos escuchado de médicos, de doctores, es que tienen que esperar hasta que sea demasiado tarde y probablemente al hacer eso ponen en riesgo la vida de su paciente. Cuando vemos una crisis y tantos retos a nuestros médicos, a nuestros profesionales de salud, esto también lastima la iniciativa, la convicción, la facilidad que tienen estos profesionales de hacer su trabajo. La ley es muy extrema. El eliminar el aborto en prácticamente todos los casos, aún en casos de violaciones, aún en casos de cuando se ha embarazado una niña, ha sucedido. Entonces, la gran mayoría de la población se opone a una ley tan extrema. Y para mí, lo que son desastres naturales, estamos en medio de temporada de huracanes, es algo que abordamos, nos preparamos siempre para estar mejor, pues más listos. Este es un desastre casi que causado por el hombre. No hay necesidad de poner tantas vidas de mujeres en riesgo con una ley tan extrema. Se puede discutir, pero bueno, hay que haber excepciones. Esta ley no tiene prácticamente excepciones y sabemos, escuchado por parte de los profesionales médicos y también médicos en nuestro sistema hospitalario, que va a hacer que su trabajo sea muy difícil y va a poner las vidas de mujeres en riesgo. Any other questions?
Let me give
Yeah.
a brief comment on the question related to a woman's right to choose. I think that it's important for men to have a voice in this because women don't become pregnant by themselves. And it's time for men to take a stand for women such that women will know that we understand the plight and the decisions that have to be made. And this is about a woman's right to choose how she will handle her body and her autonomy and her future. So it's something that men have to decide that we're going to take aside. I stand with the women. This is as draconian as it can get. Texas has gone off the scale again. And at some point, this is going to be reversed. Unfortunately, there will be a lot of suffering in the interim. I regret what the Supreme Court has done. And I believe that others who supported this are starting to regret it. I saw a person who holds public trust in another state bemoaning the fact that a woman was suffering and he had voted for this type of draconian legislation. So men, we've got to step up and stand shoulder to shoulder with the women of the world. Our time has come. We've got to be there with them.